Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. 5 ways to relieve gout pain fast. Gout flare-ups can develop quickly, causing severe joint pain lasting anywhere from several days to a week or longer. When symptoms strike, there are things you can do to obtain rapid gout pain relief, including home remedies like ice packs and over-the-counter, OTC, pain medications like Advil. /r/n/r/n While many gout flare-ups can be treated at home, those that are severe or last longer than 48 hours may require treatment by a healthcare provider and the use of prescription drugs like prednisone or uric acid blockers. /r/n/r/n You can also prevent gout from recurring by eating a low-purine diet, exercising regularly, and taking preventive medications. /r/n/r/nGrace Cary Getty Imagesrnrn According to the American College of Rheumatology, ACR, the treatment of a gout flare-up should start within 24 hours of the first signs of an attack. Early treatment may not only reduce the severity of symptoms but also the duration of an attack. /r/n/r/n Gout, also known as gouty arthritis, occurs when uric acid crystals accumulate in joints of the body, most commonly the big toe. Other common sites of accumulation include the elbow, knee, wrist, ankle, and instep of the foot. Gout rarely affects more than one joint at a time. /r/n/r/n When an attack occurs, the first sign is often a burning, itching, or tingling sensation in the affected joint, followed by increasing stiffness and soreness. These early warning signs generally occur 1 or 2 hours before the classic symptoms of gout appear. /r/n/r/n These include /r/n/r/n Oftentimes, there will be no warning signs, and symptoms will develop abruptly in the middle of the night, awakening you from sleep. /r/n/r/n The first step to treating a gout flare-up is to quickly relieve pain, followed by efforts to bring down uric acid levels in your blood. There are simple ways to do this at home. /r/n/r/n One of the first options for gout pain relief is nonsteroidal anti-inflammatory drugs, NSAIDs. These work by blocking an enzyme called cyclooxygenase, COX, that the body uses to make prostaglandins. Prostaglandins, in turn, are substances that induce inflammation and pain. /r/n/r/n By reducing prostaglandin levels, gout pain and inflammation can be quickly eased. /r/n/r/n NSAIDs commonly used for the treatment of gout include /r/n/r/n aspirin. Salicylic acid is not used to treat gout because it can cause the retention of uric acid in the kidneys, increasing the risk of kidney stones. /r/n/r/n Rapid relief from gout pain can be obtained by placing an ice pack, cold compress, or even a frozen bag of peas on the affected joint. /r/n/r/n Ice application works by causing the constriction, narrowing, of blood vessels. This not only helps ease inflammation but also quickly reduces throbbing pain and swelling of the joint. /r/n/r/n You can ice the affected joint for 15 to 20 minutes, placing a cloth barrier between the skin and the ice pack to avoid frostbite. You can do this several times a day until acute symptoms start to ease. /r/n/r/n Gout gets worse with movement, particularly when the big toe is involved. The direct pressure and rush of blood to the foot can make walking unbearable and increase tenderness to a point where even the weight of a bedsheet causes pain. /r/n/r/n Until the acute symptoms pass, it is best to stay off your feet. By elevating the affected joint above heart level, you can help reduce the throbbing pain, swelling, and redness. /r/n/r/n If your big toe is affected and you need to move around, get a set of crutches from a local medical supplies store. Many offer short-term rental and free home delivery. /r/n/r/n Drinking plenty of water can help dilute uric acid concentration in your blood and flush excess uric acid in your urine. It may also help prevent complications like kidney stones and hardened joint crystals called ofthe. /r/n/r/n Experts recommend drinking up to 16 cups, 4 liters, of fluid daily, at least half of which should be plain water. Avoid alcohol, especially beer, which can contain compounds called purines that increase the risk of gout. /r/n/r/n As with home remedies, the medical treatment of gout is aimed at rapid pain relief and the rapid reduction of uric acid levels in the blood. /r/n/r/n Depending on the severity or frequency of attacks, the duration of treatment may last for as long as 7 to 10 days or even more. Undertreating gout can lead to a rebound of symptoms, in some cases worse than the original attack. /r/n/r/n As a disease characterized by inflammation, gout is treated with a wide range of anti-inflammatory drugs that work in slightly different ways. Some of these medications may be used on their own or in combination with other drugs. /r/n/r/n There are several prescription drugs commonly used for this. /r/n/r/n Uric acid lowering therapy, also known as urate lowering therapy or ULT, involves medications that either block uric acid production or increase the excretion of uric acid from the body. /r/n/r/n ULT is typically reserved for people with gout who have ofthe, kidney stones, organ or tissue damage, or 2 or more gout attacks per year. /r/n/r/n There are 4 prescription drugs commonly used for this. /r/n/r/n In some cases, acute gout pain and inflammation can be treated with an intra-articular, joint, injection of cortisone. Cortisone is the synthetic version of the stress hormone cortisol, which quickly dampens the immune system to relieve inflammation. /r/n/r/n The shot, delivered into a joint space, can effectively suppress pain for several months. Cortisone injections are generally reserved for people with recurrent, severe gout attacks or those who experience gout in multiple joints at the same time. /r/n/r/n Although the evidence supporting their use is lacking, there are several natural remedies that people commonly turn to for the treatment or prevention of gout. /r/n/r/n These include /r/n/r/n Once you've finally reined in acute gout symptoms, your next goal is to keep gout from coming back. This can be done with lifestyle changes, medications, or a combination of both. /r/n/r/n Healthy lifestyle choices correspond to longer remission rates in people with gout. The 3 primary goals include /r/n/r/n In people with a history of gout recurrence, prophylactic, preventive, medications may be prescribed to reduce gout production and/or increase gout excretion. /r/n/r/n These involve many of the same ULT drugs used during acute episodes that are taken at a lower daily dose to avoid toxicity and side effects. /r/n/r/n If you are experiencing an acute gout flare-up, there are things you can do to alleviate the pain. These include at-home treatments like rest, ice application, OTC painkillers, and drinking plenty of fluid. Prescription drug options include corticosteroids, Cary, colchicine, xyloprim, allopurinol, and probenecid. /r/n/r/n Certain cases may benefit from local cortisone injections. There are even supplements that some people believe can prevent or treat acute gout pain. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.